started out with 2 tumors on my liver. Before I had my first chemo treatment, which was in May 2022, there were 2 more tumors had come. So now I'm looking at 4 tumors, or they're looking at 4 tumors. Then when I go for the chemo, they do what is an angiogram, which is a closer look, even than the MRI of your liver. And they said I had 7 lesions, which means I had the possibility of having 11 tumors, but the lesions were small. So they gave me that. They gave me the chemo treatment, and they set me up for another chemo treatment in October. But by the time they took the second, underwent the second chemo treatment, I had something like 4 large masses and 19 lesions. So my oncologist said, there's too many lesions there for any more chemo. She suggested, here's my nose again, she suggested that I take a clinical trial. USC University School of Medicine were doing clinical trials for 2, and I meant to write these 2 drugs down and I forgot. They were doing a clinical trial actually of 2 new drugs. I call them A-mab and B-mab because they are acituzumab and bezivabamab. Bezivabamab. To go with the original drug, Sorbit, to see if the A-mab and the B-mab would enhance the taurine as a trial. Now, my oncologist, she kept telling me the negative side effects. So I said, well, and after a while, first I said, yes, okay, I'm willing to try something. And if it works, then that's good for me and for them, for whoever's coming after me. However, she told me so much of the negative, it scared the heck out of me, really, literally. I said, okay, I changed my mind. I don't want the clinical trial. I'll look for other avenues. So I began a journey to look for alternative medicine. So I was looking in particular, I had heard that they were doing clinical trials where they would take your white blood cells out, enhance them with a protein, put them back in so they are mightier fighters, because it's the white cells, lymphocytes, who do the fighting off diseases, viruses, all that kind of stuff. So that's what I was looking for. They were doing that. Unfortunately, I found only they were doing it for blood. So that canceled that out. Unfortunately for me, I looked for about a year. Me and Tech University parted the ways, because after I didn't want to take the trial, they said, well, there's pretty much nothing else we have for you. I went a year without any type of treatment, just a bunch of supplements. I started feeling funny. When I started feeling funny, I went to the hospital. The hospital told me that the tumors or the cancer had metastasized to my bones, to my adrenal glands, to my vertebra. Now, that's when I knew I'm walking on a thin line here, because once the cancer metastasizes, you're in stage 4. So I left California, Los Angeles, because that's where Tech is. I came to New Jersey. I went to a hospital, Rutgers University. It's called Barnabas Cancer Center. They didn't offer me anything. So I went from there to MD Anderson in New Jersey, and they weren't offering me, they offered me a treatment that's coming out of Canada. I took one treatment, and then while I was in their waiting room, they had, literature, they had books all about how to cancer, who's doing what. And I found out that in Kansas City, Missouri, they're undergoing they're undergoing a clinical study where they're testing CAR T cells for liver cancer. In between the time I was looking for this and the present time, the CAR T cells for the blood had been successful. The clinical trial had been successful. The FDA has approved it. So with that, now they have the blood CAR T legalized. So then now they're doing the study on the liver. So the doctor told me, come to Kansas City, because he looked at my medical records and what was being done, what were failed treatments. I came to Kansas City. He talked with me. He said, unfortunately, you don't qualify for the clinical trial yet because you need to have tried two failed things. The chemo was no good. The chemo did shrink the tumors, but now they're back. And the immunotherapy, he said, you're not taking it long enough. Stay here in Kansas City. We'll give you treatment, and in 4 or 5 months, if the treatment that we give you here is unsuccessful, then we'll consider you again for the clinical trial. So right now I'm in sunny Kansas City, Missouri, sitting in the, they call it KU, but it's the University of Kansas Medical System. And here is where I get my cancer treatments, right upstairs. So it has been a journey. Now, when I was first diagnosed with just the liver, and immediately after the chemo, I had a little sharp pain in the liver area. It went away in about 6 days. But since it's gotten to my bones, and now I know what cancer feels like, because the bones is very painful, unfortunately. It's more painful. I'm acutely aware of what I have, what it's doing, and I had this thought, but it flew right out of my head. So I understand. I can now, I want to get into a therapy group with other people who are living with cancer, not survivors, not the one where their cancer's in remission, but who are actually living with it. I want that because I think that would help.